Like so many others, 4-year-old Orville Young caught a cold this past summer in Minneapolis. But unlike the others, his case was literally 1 in a million. Days later, he lost feeling and movement in his right arm.
There have been times where he's just like, oh, I didn't like it that my arm got paralyzed.
What are the doctors going to do?
Make my arms not be wonky.
He uses his left arm to get that arm up.
Then higher. Okay.
Nervous, anxious.
And 7 months later,
Choppy, how are you?
he is here.
Put it on your finger for 1 second.
Preparing for nerve transfer surgery at Shriners Hospitals for Children in Philadelphia.
What do you think will be the hardest part of tomorrow?
Waiting. It's a very long, intricate surgery, and he's going to be under general anesthesia for a long time, and that's kind of terrifying.
I can't think of a line.
Orville is one of about 215 kids across the country diagnosed with acute flaccid myelitis, or AFM, last year. The CDC has only been tracking the disease since 2014, so the exact cause is still unknown, and the treatment is still case by case.
Have a disease which is really poorly understood and is so frightening, right? I mean, you have a normal child who suddenly isn't normal. That's devastating for families.
Dr. Dan Zlotalo at Philadelphia Shriners Hospital is emerging as one of the pioneers when it comes to AFM treatment. He's performed nerve transfers on 18 AFM patients. Today, Orville will be the 19th. And our cameras are going with him.
All right, handsome, you ready?
For the first time in a surgery like this.
What we're doing is we're taking a nerve that works and moving it to a nerve that doesn't work.
Orville's case is not as severe as others. His right bicep and shoulder are the only areas affected. So Dr. Zlotalo will be transferring 2 healthy nerves to the paralyzed areas to replace the damaged ones. You can see the team of surgeons checking the strength of each nerve with an electric stimulator. When a nerve is viable, like the one they're testing, you see it send a jolt of movement through the arm. When they find the right donor nerve, they simply cut the healthy one and connect it to the damaged one with a few drops of glue.
It's splicing a wire. That's really all you're doing. I mean, it's a fancy way of splicing cable together.
Hoping that it can help him, you know, because he really wants to get better and get strong.
He's just sleeping. He's tired.
Buddy, can you wiggle these fingers for me?
It's over. That's the best part. It's done with. Just gonna go snuggle my baby.
The surgery takes a few hours. However, it will take several months to determine if the 2 nerve endings will actually work together and improve the movement in Orville's right arm.
I hope that he can put a cup in a cupboard, that he can put his own shirt on easily, and he can open doors without struggling. The little things that in your day-to-day life are important.
For now, Orville's odds have improved. But this story is also about the other kids with AFM, the other families who've struggled to find resources to navigate this scary, mysterious disease. It's the reason the Youngs invited us to Philadelphia.
We want people to keep thinking about it and keep taking action so that families get better information and better help.
Because some of these kids are never going to walk or talk again. And my son is not that severely affected, and I have a voice and I can use it. I can do things like this, and I think I should.
Oh, these are jump